Hey everyone, welcome back to the channel. Today we're rediving into something that could have a huge impact on families across the country, especially those who depend on Medicaid. But that section, it just got shut down. Not by a famous senator or big name, but by someone you've likely never heard of. The Senate parliamentarian? Drop your thoughts in the comments. I read everyone. And if you like getting real, no-fluff breakdowns like this, go ahead and hit that subscribe button. It really helps us keep creating content that keeps you informed. Now, you may have heard about former President Trump's ambitious new tax proposal nicknamed the One Big Beautiful Bill. Sounds catchy, right? They claimed it could save the country up to $300 billion money that could help fund the tax cuts. But here's where things got tricky. When the Senate parliamentarian reviewed that section, she ruled that it didn't qualify under the rules of reconciliation. Well, that's exactly what we're going to break down right now. But it comes with strict rules like whatever's in the bill has to directly impact the federal budget. And according to the parliamentarian, these Medicaid changes were more policy than budget. So she tossed them out. Senator John Thune says they've got Plan B in the works. But not everyone in the party is on board. Senators like Josh Hawley and Susan Collins are raising red flags, especially about what this could mean for rural hospitals. So this isn't a left versus right issue, it's a systemic one. Some of them are already hanging by a thread, and cutting off funding could force them to shut down. Imagine living in a small town and suddenly the closest DR is 2 hours away. That's not just frustrating. That could be life-threatening. These are huge questions with real human consequences. All tossed out because they didn't meet the strict budget impact requirement. Over in the House, Speaker Mike Johnson is juggling his own challenges. Some Republicans want to keep the SALT deduction caps, others don't. And a whole different group is threatening to pull support if clean energy programs get touched. So even if the Senate figures out their end, this bill still has to survive another political minefield in the House, or in some cases, clinics and services might disappear altogether. On the other hand, if the changes don't go through, it's about who's protected, who's at risk, and who steps up when it really matters. Because these are your services, your taxes, your future. The tax breaks might be smaller, or funded by cutting other programs like SNAP or energy assistance, or building a smart, informed community. Hearing your voice matters, but don't think those fights are over. They're likely to resurface in future proposals. Why does that matter? Because some states have been using that tax system to pull in more federal dollars. Without those Medicaid savings, the numbers don't add up the same way. There was a story recently about a mother in Missouri. Her daughter needs weekly therapy for a rare condition, and Medicaid is the only way they can afford it. But unless they can settle these Medicaid disputes and fast, that deadline might come and go. Without that support, she said, they'd lose everything. These are the kinds of lives hanging in the balance, while lawmakers argue over budgets. Basically, the state collects money from providers, then uses that money to get matched by the federal government. It's a kind of budget gymnastics, and it's been happening for years. According to her, we're talking more like $100 billion if we're serious about saving those hospitals. That's a massive funding gap. It shows just how split the party is right now between saving dollars and saving lives. Because this isn't just politics, it's personal. It's about whether your nearest hospital can stay open. It's about whether you can still get care for your kids. Senator Tommy Tuberville even accused her of being woke, but that doesn't really hold up. She's not a political appointee. She's a rules expert. Like a referee at a game. When your team's play doesn't work, blaming the ref doesn't change the rules. And it's about how government decisions echo into our everyday lives, whether we see it or not. But what you probably haven't heard is how a major piece of that plan just hit a brick wall in the Senate and did. S, a part that directly affects your health care. C, to help pay for those sweeping tax cuts, the plan included some deep changes to Medicaid changes that were supposed to save the government hundreds of billions. So what does this all mean? How does a behind-the-scenes decision in Washington affect your family, your local hospitals, or your taxes? Now before we dive in, let me ask you, do you think taxes and healthcare should be linked like this? Alright, let's unpack what just happened. So this all centers around a section of the bill that tried to limit how much states can tax Medicaid providers, things like hospitals and clinics. Trump's team wanted to put a cap on that strategy, saying it was being misused. Now, reconciliation is basically a fast-track process in Congress that lets lawmakers pass big bills with a simple majority. And that is a big problem for Republicans trying to balance the cost of those massive tax cuts. Now, GOP leaders are calling this a temporary hiccup, not a total failure. Even Trump himself reportedly got concerned after Hawley brought this up. And when he pauses to think about something, well, that's saying a lot. To try to soften the blow, lawmakers floated a $15 billion rural hospital rescue fund. But Collins says that's not nearly enough. Meanwhile, some conservatives are turning their frustration on the parliamentarian herself. Interestingly, the exact same thing happened back in 2021, only that time it was Democrats trying to raise the minimum wage, and they got blocked by the same parliamentarian. And it gets deeper. Other parts of the bill also got the axe. Proposals to stop Medicaid from covering gender-affirming care, defund Planned Parenthood, and restrict access for undocumented immigrants. All of this is really a sneak peek at the bigger battle brewing in Congress: who qualifies for care? What kinds of treatment are considered essential, and who gets to decide? Let me give you an example. And it's not just the Senate. In time, it's running out. Trump wants this bill signed by July 4th. So what does it all mean for you? Medicaid funding is changed. Your local hospital could see cuts. You might notice longer wait times or higher bills. Either way, the decisions being made behind closed doors in Washington, they ripple into your life. Because this isn't just about dollars. It's about priorities. So tell me in the comments, what worries you more, rising healthcare costs or the way Congress is handling all of this? Let's start that conversation. And if you found this breakdown helpful, hit that like button and subscribe for more updates that actually make sense. Thanks for sticking around. I'll catch you in the next one.